populations. And so we really wanted to get out there and try to make sure that we were making a difference in those communities, but really at the community level, not at the national level, not at the state level. So we started the Molina Cares Accord as a way to really invest in local communities by supporting meaningful and impactful program change there at that level. So really looking through the data that's available out in those communities, and then also looking at what the community needed, what the state Medicaid agency said was needed and was going on, what the Department of Health was finding with some of the cases and some of the things going on, and then what really needed to change in order to help balance out some of those health inequities and really start to tackle them. And so we launched this program back in 2020. We've now got 20 sites across the nation where we work out in the community to identify what those needs are and identify those projects for funding. But one of the aspects of the Accord is to really identify things that can be funded by our charitable foundation. Molina has a healthcare charitable foundation that operates nationwide. And one of the things we've done under the Accord is really identify who are the partners on the ground that are really making a difference to address these health disparities and to address issues that really need grant funding. We also really listen to the community when we're going out to do that work. So again, what is the Medicaid agency saying that they need help and support with? What is the public health office saying? What are the policy folks in the state really looking at? And then especially, what are people on the ground feeling and experiencing in terms of health inequities and in terms of problems across their states, and really trying to identify those partnerships and best practices that are going on for funding. And one of the things that's a little bit different about this work and the foundation work is it's really driven towards what the community needs rather than the needs of the managed care company and what the managed care company is trying to do. So again, it's really trying to go out there across the nation in those communities and make impacts. So the grants and the funding from the charitable foundation vary from state to state. But today, next slide, please. One of the things that we want to talk a little bit about are the health inequities that are out there in communities and give you some examples of that. But I want to spend some time just talking to the healthcare leaders that are on our webinar today. From my perspective, as having been a former Medicaid director in a state, as a way to go out and use these local foundations that are in your community to really support and address some of your priorities. Back when I was a Medicaid director in the state I was in, we didn't have really large foundations doing a lot of operations there. So it was a little bit challenging to go out into the field and out into the community to try to find these grant makers who were making decisions about providing grants in states. But it's definitely something I would say you need to identify in your state, whether you've got a large organization like the California Healthcare Foundation in California, or even a small local foundation that might be offering some programs and doing some grant making in your state, really to go out and meet with them and identify who they are, and then talk to them a little bit about what they can do to kind of scale up or continue existing programs that you may be looking at funding, but maybe you don't have enough state general funds to do the work, or they're programs that really won't fit under your Medicaid requirements in your state or under some of the state programs. Because one of the benefits about working with those local foundations is they have a lot more flexibility around who they can fund with grant money and how they go about doing that, identifying needs in the community that need to be met and working with you on that. So I would really stress to people that the first step is just to itemize who those foundations are in your community, but then also look out nationally if there's not enough of them. There are a lot of national foundations started by health plans that work across many states. The Molina Healthcare Charitable Foundation obviously is one of them, but there's others out there, Robert Wood Johnson, Kaiser, the Commonwealth Fund and SCAN Foundation that focus a lot on different aspects and needs out in the community. And so identifying those who might be doing work in an area you're interested in and trying to go back and make those connections is really important. It's not only using the grant money for funding folks on the ground in your state, but they really have access to a lot of experts and entities if you're looking for somebody to help you make policy decisions or program design decisions. A lot of those foundations have connections nationally where they can help bring those individuals back to your state to help you with some of those programmatic ideas. So next slide. So today we're going to walk through 3 of those that really were programs that we touched upon and reached out to in order to address health disparities. We'll talk a little bit about the UCLA Health Equity Challenge. And this was one actually that we at the foundation identified as an area of need in California, really trying to go out into the community and see what things we had learned from COVID and practices that people had quickly put into place to try to help affect some change around those health disparities and ways that we could grow those. And we found a partnership with UCLA and UCLA willing to work with us to go back and find some of these younger students who were interested in taking on these challenges. And they're not that young, but younger than me. Younger students who were willing to take on these challenges in their graduate programs and really make a difference. So you'll hear about those today. You'll also hear about Thank Babies Michigan, which is a program of 16 organizations that's been awarded, and so we'll get to discuss that. And then finally, the Medicaid Innovation Collaborative, which is an exciting project, again, across the country, opened up to Medicaid agencies who are looking for innovations and ways to continue programs forward and bring them forward in their state. So Shani, I'm gonna, without further ado, turn it back to you so we get to hear about these programs. So thank you.
Thank you very much, Carolyn. That was excellent. With that, I have the honor of turning it directly over to Catherine, who will continue our presentations.
Thank you, Ashani. Good afternoon. I'm delighted to be here today to share some information with you about the Health Equity Challenge program. When the Molina Healthcare Charitable Foundation first brought this idea to us at UCLA, we were thrilled. We were actually just in the process of renaming our Health Disparities program at the Center for Health Policy Research to a Health Equity Program of Research. And we knew immediately that we had a shared vision to launch a program that would identify and support our next generation of health equity leaders, and a program that would encourage the creation of community-based innovations to address health inequities at the local level. The overarching goal was to encourage students to develop innovations to ensure that opportunities to attain one's full health potential are realized and to eliminate disadvantages due to social position or other socially determined circumstances. Next slide, please. You can go back one, please. Thank you. We know that finding solutions in the community is critically important because health happens everywhere, and good health is dependent upon community members' access to resources and opportunities. So the Health Equity Challenge program was designed to serve as a bridge to link identified community needs and health inequities with new and innovative ideas emerging from graduate students, scholars, and clinicians in an academic setting. The program provided an opportunity for an exciting and productive collaboration between Molina Cares, UCLA, and local community-based organization that served the common interest of all the partners. We've long understood the value and benefits of engaging with community in the research that we do at UCLA, and the Health Equity Challenge provided another opportunity to advance that cause through the development of students' ideas and connections to the CBOs that they selected to partner with. The program was announced in early January of this year when we invited UCLA graduate students from multiple schools and departments across campus to submit a 2-page application summarizing their innovative ideas for addressing health inequity in the local community. We assembled an independent review committee comprised of 5 state and local health policy leaders, program executives, and administrators, all whom have a deep understanding of community and health disparities. Next slide, please. From our pool of more than 24 applicants, the independent review committee selected 10 students who were each awarded a $2,500 stipend. We then had the opportunity to work with this inspiring group of students as they participated in a 10-week mentor program, working with a primary mentor, consulting with members of the UCLA and Molina Cares teams, and developing a full proposal of an innovation that could be implemented by a local CBO partner. The mentor program started in late March, and students submitted their final proposals in early June. The independent review committee reviewed the final set of proposals and selected their top 2 winners, who were granted an additional $2,500 stipend, while their partnering CBO was awarded $50,000 by Molina Cares to implement the winning idea. Next slide, please. So here are pictures of our 10 finalists who represent a diversity of disciplines and a diversity of innovative ideas. Their proposals span a broad range of issues and a wide array of populations. Just to provide a few examples, in the middle of the top row is Bianca Salvetti. She's a graduate student in nursing who worked with a local LGBTQ+ center to develop and promote a gender-affirming treatment decision aid for transgender and gender diverse individuals and their caretakers. Directly to her right is Lei Chen, a doctoral student in social welfare, who partnered with the Mexican American Opportunity Foundation to develop a practice research consensus program to promote the use of data to improve service delivery to older Latinx and Asian immigrants in Los Angeles County. And to Lei's right is Sky Shodal, a public health graduate student who developed a culturally tailored prenatal breastfeeding toolkit for Native Hawaiian and Pacific Islander pregnant parents and for their extended family members. Now, while all 10 of these students had winning ideas, at the end of the day, only 2 could be chosen for the final prize. Next slide, please. So one of our 2 winners is Alma Lopez, who is pursuing a dual degree in public policy and medicine and specializing in obstetrics and gynecology. She's committed to addressing disparities in maternal morbidity and mortality. Next slide, please. Alma's winning idea focuses on the mental health needs of mothers of color. Working with her community partner, Shields for Families, she has developed a project to improve maternal mental health for mothers with perinatal depression in South Los Angeles through English and Spanish online peer support groups. Next slide. Our other winner of the Health Equity Challenge is Angelica Johnson, a medical student in the Charles R. Drew UCLA Medical Education Program. While her innovation also focuses on mental health, her point of intervention is at the health professional provider level. And I'm so pleased to congratulate her once again, as she's here in person, well, virtually. And so happy that she's able to join us today to tell us directly about her project. Angelica?
Hi, everyone. My name is Angelica. I am a 4th-year student in the Charles Drew UCLA Medical Education Program. Very thrilled to be here. I will be applying to family medicine residency in the upcoming fall. My project is Step Up and Stand Down, a mental health de-escalation toolkit for providers. Next slide, please. So in recent years, there have been these tremendous pushes towards addressing mental health, especially mental wellness in schools and workplaces, in medical offices. And this has especially been the case with COVID-19 and it's really placed in the spotlight. However, mental health crises still continue to be stigmatized. And when a patient is experiencing a mental health crisis, the base assumption is that that person is going to harm someone and to call 911, let the police handle it. And this sets up a paradigm where mental health crises are just inherently criminalized. And this mental health disparity also very much is intertwined with racial disparities, for which mental health kind of serves as a conduit for people of color to be seen as more violent, more likely to be criminalized, more subject to violence. And it's these communities that really suffer the most from this police-centered approach to mental health. Next slide, please. In the community, especially we look at Atlanta, we look at Washington State, San Francisco, and beyond, there are these new initiatives that utilize first responders who are trained specifically on mental health first aid and de-escalation instead of police intervention. And these are being piloted to promising initial results. This is specifically in the street setting, so in the community. But there aren't any initiatives that exist in the hospital setting. Healthcare providers are trained to call security reflexively in the face of any disagreement, any sense that or gestalt that something may be escalating in the future. There is no specific training throughout medical school or residency or beyond to teach providers or healthcare workers rather to de-escalate effectively. And that seems like there's just so much opportunity there to use that therapeutic alliance to really work with patients who are in a time of crisis. So next slide, please. My project aims to create this educational model that teaches healthcare workers about mental health de-escalation, specifically in the clinic and hospital setting. Next slide, please. So my community partner is Charles Drew University of Medicine and Science. It's in South Central Los Angeles. It's a historically Black college that trains students in the fields of medicine, nursing, pharmacy, physician associate school. And one unique aspect of their training focuses on interprofessional simulation training. So we are trained in working with each other across the different disciplines and schools. And we are also provided with resources such as standardized patients. And we are trained specifically on high acuity situations as well. So mass violence or environmental emergencies. And the plan would be to embed some sort of mental health de-escalation training into the simulation training setting. In addition to the school itself, there are multiple affiliated clinical sites, and these serve primarily an uninsured or publicly insured population, including Martin Luther King Community Hospital, the University Muslim Medical Association Community Clinic, as well as Kedron Community Health Center. Next slide, please. And the goal of this project would be to develop mental health de-escalation training and resources that are specifically developed with the experience of those who have experienced mental health crises in the past or were hospitalized for mental health related reasons. And the idea behind this is to actually speak to the community, ask, how would you want to be treated in a situation like this? And there is actually very limited research and development in this area thus far. And then the goal would be to take these insights from the experts themselves and implement this education into the Charles R. Drew University curriculum in the training of future health professionals. But the other goal of this project would be to implement this training as well into a setting, a virtual resource setting for current healthcare providers who are currently in the clinics affiliated with Charles R. Drew University, so that they also have this resource available to them at the clinics to be able to de-escalate and really level with patients where they're at. And that's my project. Thank you for listening to my pitch. I really appreciate it. And I will yield the floor back to Ashani.
Thank you, both Catherine and Angelica. I have this wonderful, easy job at this point. I get to keep passing it along to colleagues that are on the panel. So with that, I'd like to give the stage over to Dawn.
Thank you, Ashani. Thank you so much for the invitation to join this awesome panel today. I'm Dawn Bell. I serve the Early Childhood Investment Corporation in Michigan, and I'm delighted to share about the Navigator program here that's happening in Michigan. This is a partnership with Molina Cares and the Pritzker Children's Initiative. So I'm going to refer to my shop as ECIC from here on out because it's several syllables. So ECIC is a statewide nonpartisan organization. We envision a future where all young children and their families thrive. We primarily work in Michigan, though increasingly we're being asked by partners around the country to do some consulting, particularly around one of the key aspects of our work, which is centering family and parent voice and leadership. Over the past 15 years, ECIC has invested nearly $250 million, leveraging public and private partnerships to increase focus on the earliest years. Next slide, please. So Think Babies Michigan, ECIC serves as the backbone of this multi-year initiative. We have a 2,000 member strong coalition from across the state. We're focused on the first 3 years of life and really looking at both the health, education, and family economic stability needs, targeting families who are living at or near 200% of the poverty level, and how can we increase access to services and programs and decrease inequities that families in that space are experiencing. So a key question we've been wrestling with here in Michigan is, how do families access services? We are seeing, I think this might be a common challenge for many of you in your states, we're seeing underutilization of prenatal to 3 services and programs. And of course, we see the inequities that exist and persist because of that. So to answer that question, we're really delighted to partner with Molina and offer what we're calling the Navigator mini grants. So these are 6-month grants, really granted to parent-led and BIPOC-led grassroots efforts in communities across Michigan. So you see this map here of the mitten with the 15 counties that are represented. They have the potential to impact 163,000 children of color. And most importantly, This entire initiative was led by parents of children under the age of 3 who have lived experience with the system. And the grants are both monetary, and the grantees participate in a community of practice where they get both policy expertise and they're getting to interact with 7 parent leaders from across the state as they work on their demonstration projects. So they're kind of answering this question of like, how do families navigate the system and what are their ideas to improve that, with the whole goal of shaping policy change, both big P and small p. Next slide. So our partnership with Molina Cares, we were connected to Molina through a colleague, through a mutual relationship with someone in a nearby state. And it started really as a networking conversation, no expectations, where I was really delighted to learn that we had shared focus around centering family and parent voice in policy solution. And from there, the kind of idea, the germ for the program began. And the other shared connection that we have with Molina is a focus on the social determinants of health. So these grants over 6 months, again, parent-led, BIPOC-led, community-led solutions, right? In many cases, we know it might be as simple as a community is really limited resources, and so families have to go physically to an office to enroll and access services like Head Start early on, childcare subsidy or other Department of Health and Human Services, or get enrolled in Medicaid. And if they had a simple QR code or something that was text friendly, more families might access it. And it can go all the way down the spectrum of, do they have a trusted partner helping them navigate the system? So the whole concept here is not looking at one specific program, but really looking at this age population and how can we support communities to come up with community-driven solutions. Next slide. So they're 2 or 3 months into this. Let me give you all a sneak preview of the promising strategies that these communities around Michigan are learning. So I mentioned trusted messengers are key. So several communities are doing demonstration projects where they're training parents to connect other eligible parents to services. And they're seeing an increase in enrollment and a decrease in sort of stigma and misunderstanding about how to navigate the system. Partnering with employers to provide assistance to their employees, utilizing non-English speakers. This is huge. Some of the counties are demonstrating how they could become a hub to connect families to numerous kinds of programs and services. Families experience all of this as one system, one early childhood system. Often I know when we look at our bureaucratic paperwork, we see different tracks, different contracts, different funding streams, but for families, it's one system. So how can counties create hubs? They're also doing demonstration projects where they're doing information bags to parents where they frequently visit, pediatrician's office, grocery stores, schools, workplaces. And again, this is increasing awareness, and then they're starting to see numbers go up. And of course, integrating social media strategies and QR codes. The vast majority of the population that they're seeking to reach do have access to cell phone and text message. Next slide. So if you all love this, please visit ecicforkids.org and get signed up to either join us live, or you can watch the recording on demand on August 25th. We're going to do a webinar featuring the parent and community leaders who will be sharing the lessons from the strategies they implemented and the early impact. In September, we'll be publishing data from all 16 projects. And then in October, these groups, parent-led, will be doing a policy brief with lawmakers here in Michigan, because we already see that there are some policy changes that they can shape. Thank you so much. And with that, I will pass it to Eamon.
Thanks, Dawn, and thanks to everyone for being here today. Really, really excited to be a part of this conversation and already inspired by such amazing work that's happening all across the country. So thank you. My name is Eamon Anderson. I with Acumen America, and we have launched a program called the Medicaid Innovation Collaborative in partnership with Molina Cares, and I'm excited to share a bit about that with you today. Next slide. The Medicaid Innovation Collaborative seeks to advance health equity in Medicaid. And the way we go about doing that is by identifying and implementing innovative technology-driven solutions that serve those who need it the most. Next slide. Now this work is complicated because of the varied stakeholders required to make this vision become a reality. And our model in particular has really focused on a handful of those stakeholders across the Medicaid value chain. particularly beneficiaries themselves. We really center on the voice of beneficiaries and hold their experience central to all that we do. And our model also is built to serve state Medicaid agencies. So we provide additional resources and operational leverage to state Medicaid agencies to really enable these the vision that these states hold around advancing these priorities of health equity. We also work very closely with the managed care organizations. These are the folks that are actually going to be implementing some of these innovative solutions. And how do we make sure that we can really work through some of the friction and making sure that these solutions get deployed and create the impact that's possible out there in the real world? Now, these are only a handful of the folks out there, but we really built a program model trying to bring together everyone to center around this goal of advancing health equity through innovation. Next slide. So how do we go about doing that? It really begins with this multi-state learning cohort. So we bring state Medicaid agencies together to really orient themselves around a shared health equity goal and focus on that priority together. We then deliver in-depth original research to those partners so that they can center on member experience. What solutions, what problems are members facing? What solutions do they want to see? And how do we bring their voices to the forefront of this work? We then layer on top of that technical assistance so that these states have the opportunity to understand what else is working across the country, what other solutions have other states deployed to think about how we can actually create an environment that allows these innovations to thrive. And then we go out and identify and select the best innovations out there with an innovation showcase that really highlights the best of the best from across the country that are solving health equity challenges, aligned with the state priority, and informed by member voice. Next slide. So all of this program is layered across a 12-month calendar year. So states form together, align on a health equity goal, TA and research are deployed, and that research yields an innovation showcase, and then we work with MCOs to implement this. It's complicated, and it's super exciting to see all these voices come together. Next. So we launched this work in our first cohort a year ago, and we have 3 states participating: Arizona, West Virginia, and Hawaii. We focused on behavioral health as our shared health equity theme for this first cohort. Arizona and West Virginia focus specifically on adolescent behavioral health, and our partners in Hawaii have focused on the intersection of behavioral health and maternal health. What's interesting about this is we've been able to explore a diversity of solutions and challenges and create a really rich environment for shared learning across all 3 states and all 3 agencies. So in working with these 3 states, we've engaged all of the MCOs across all states into MCO cohorts and have them actively involved in this process. We launched beneficiary research where we're speaking to Medicaid members themselves, patient advocates, community-based folks working at the front lines of community-based organizations and providers that are serving these communities, really bringing that voice to the forefront of the work. We then took all of that and TA that was delivered through our partners at the Center for Healthcare Strategies and launched an RFI that was really a keyhole defined by state priority and member voice. And with that, found these solutions, a really remarkable set of innovators across the country who are solving these distinct problems as faced in these states. And we've now brought those, highlighted them in a showcase event, and are now working with MCOs across all 3 states to implement this work. Next slide, please. And this work would not be possible without partnership from Molina Cares. I'd say that, as Carolyn talked about earlier, Molina Cares plays such a critical role in enabling this kind of work to be availed to states at a no-cost basis. And I think this model wouldn't work without that. And Molina, beyond that, has been a really integral strategic partner at every element of what we do. I'd say, firstly, is a strong mission alignment, and I think that's what really brought us together in the first place. And that's what helped Molina Cares get comfortable in taking some risk and building this program with us from the ground up. And I really could not appreciate that more. There was sort of risk tolerance and mission orientation of Molina Cares as a partner. And then in our work together over the last year has been highly strategic. So thinking about how do we actually build voice and share the learnings, what's working, what's not working more broadly across the country. How do we draw upon state insight and plan insight to make sure that we're designing the program that's most impactful? And how do we make sure that we're laying the groundwork to enable this work to go to scale? So with that in mind, we're starting to think about the next cohort and plan to launch later this year with our next cohort of states. We're targeting 5 to 7 states rallied around a new health equity theme. We're zeroing in on social determinants of health to follow on behavioral health as our first cohort. And we just could not be more excited for our partnership with Melina and for the good work and transformative change that's to come. And I have the distinct pleasure of passing the baton to our partner in the Medicaid Innovation Collaborative, a personal hero and someone who I feel extraordinarily grateful to have the opportunity to work with, Director Jamie Snyder. Director Snyder, I'll hand it over to you.
Thanks so much, Eamon. The feeling is mutual. Well, I am thrilled to be here and provide the perspective of a Medicaid director in partnering with health plan foundations to drive the strategic objectives of a Medicaid agency. If we can go to the next slide. A little bit of background on Access, Arizona's Medicaid agency. We serve 2.4 million Arizonans. We're an $18 billion program. We were actually the last state in the country to join Medicaid, but we were the first state to establish a mandatory managed care model where we contract currently with 7 health plans to administer the Medicaid benefit on behalf of approximately 88% of our state Medicaid population. There are real benefits to this public-private partnership that I'm sure you're aware of. Clearly, we're able with the public-private partnership and contracting with health plans to promote competition, which enhances quality and drives down cost. It allows us to drive innovation, allowing us to really capitalize on advances available in the private sector. And then we have the ability to leverage MCO foundation funding and philanthropic efforts to advance strategic objectives or priorities of our state Medicaid program. If we can go to the next slide. Health plan foundation support has really been instrumental in advancing the strategic objectives of the Medicaid program in Arizona. One notable example of that, and Eamon detailed this in his slide presentation, has been the Medicaid Innovation Collaborative, funded in part by Melina Cares. So we've participated in 2 different Medicaid Innovation Collaborative events, one back in 2019, where we focused after seeking guidance from the community, from members, stakeholders, and our managed care organizations on areas of focus. We focused on 2 areas that really were strategically aligned with the Medicaid agency with Access, and that was whole person care and member engagement. And that Medicaid Innovation Collaborative occurred in March of 2019. And one vendor, to give you an example of how powerful the collaborative can be, one vendor really rose to the top and stood out for our contracted managed care organizations, and that was Pix Health. So 6 of our 7 contracted MCOs now contract with Pix Health, which is an application and chatbot tool that's used to serve individuals experiencing loneliness. And we have some really good data following that Medicaid Innovation Challenge and the work of the plans in contracting with Pix Health. There's some really good data to show the impact from a health outcome standpoint when members in our system engage with their application and chatbot. So currently, Pix Health is serving approximately 12,000 members in the state of Arizona, Medicaid enrolled members. 47% of the members have realized an improvement in loneliness scores through the use of the Pix Health application and chatbot tool. And most importantly, from a health outcome perspective, for those members that have used the Pix application and chatbot tool, we've seen an 11% per member per month reduction in emergency department and inpatient spend, and a savings of over $5,000 per member over a 6-month period for those that are using the tools offered by Pix Health. So that goes to show you when you're able to align priorities between managed care organizations, the Medicaid agency, and use foundation funding to support an effort like the Medicaid Innovation Collaborative, you really can make a difference long-term in terms of improving member health outcomes. As Eamon mentioned, we participated in another Medicaid Innovation Challenge and Showcase with the state of West Virginia in May of this year, so just a couple of months ago, where we brought together vendors that offered technological solutions to address the increasing need for the provision of behavioral health services directed at children and adolescents. Again, another really successful showcase, and we look forward to really tracking the progress of our health plans in contracting with the vendors that highlighted their solutions during the showcase, and most importantly, tracking the improvement in health outcomes that we see as a result of those efforts long term. If we can go to the next slide, the next two slides, I just provided another series of examples of how foundation funding from our contracted health plans has helped to advance various strategic priorities of the Medicaid agency, including our work around housing and homelessness. We have efforts that are very community specific, such as an effort in the community, the small community in Southern Arizona, Bisbee. We have efforts to purchase affordable housing units, which is a nice complement to some work that we do in providing rental subsidy dollars and wraparound behavioral health services and supports. We have efforts in the addiction treatment space, efforts to use foundation funding to prevent substance use for at-risk youth. And then importantly, over the course clearly of the last couple of years, efforts to address the COVID-19 pandemic. And one of our health plan foundations took it upon themselves to really fund a series of mass vaccination sites around the state of Arizona, really important when the vaccines were initially rolling out in the states. And if you can go to the next slide, and health equity, another area of focus for the agency. Clearly, you can see the efforts that have been funded with health plan foundation funding that's available in the state, one of which speaks to American Indian youth and programming to improve cultural identity and connectedness, specifically for the White Mountain Apache community. Social determinants of health, whole person care, a big area of focus for the agency. One of the areas that's been a real focus for the health plan foundations has been around food insecurity. So you can see a reference to the Activate Food Farm, where healthy and affordable food is provided to residents in the Phoenix metropolitan area and specific communities, which are particularly challenged when it comes to food insecurity. I think what you can see from my slides and the clear message that I wanted to convey following Carolyn's presentation, where she talked about really partnering with Medicaid agencies, and Eamon's presentation, where he talked about a specific area around the Medicaid Innovation Collaborative, is that health plan foundation funding can be incredibly powerful when it's used to align with the Medicaid agency's strategic priorities and to address the needs of the community, particularly in those areas where our funding is a little bit more limited. We have less flexibility in terms of how we can use Medicaid dollars. So I'm happy to answer any questions that you might have. I'm going to turn it back to Ashani for the question and answer portion of the presentation.
Thank you very much, Jamie. That was excellent. And I want to thank all of our speakers on the panel today for some really excellent presentations. So with that, we do want to raise some questions or bring up some questions that our audience has raised. First, do the speakers have any recommendations or guidance for other CBOs who are seeking to partner with health plan foundations? And at this point, thank you, Eamon, for coming back on camera. I invite your colleagues to do the same. I will repeat the question. Do the speakers have any recommendations or guidance for other CBOs seeking to partner with health plan foundations? And to pick on one of you, can I ask Dawn to get us started?
Sure, thanks, Ashani. So my best recommendations are lower your expectations and start the conversation by focusing on all the non-monetary ways that you can partner. What I found in the conversations with our friends at Molina and with other leaders around Michigan and around the country is that the health plans and their foundations actually they are a font for data, both quantitative and qualitative. So just start with a listening conversation about what they're hearing and seeing in the field, and share what your organization is seeing at the local level, or in the case of my organization, a bridge between the local and the state. And then the other kind of entry point for us was talking about policy issues that were impeding their goals around health equity, and what we were seeing and what they were seeing, and how we might have a shared conversation. But I think you can start with the non-monetary and really lower your expectations and see where things go. As I mentioned, it started with a really low threshold networking invitation to talk with Melina. The first conversation was going to be 20 minutes. We ended up talking for 45 because we had so many things in common and wanted to schedule more time to just begin digging into the issues.
Yeah, no, thank you for saying that. That's a perfect example. I love how you added on that example of the conversation that you had at the end. That was perfect. Any of the other panelists want to add to that, put a finer point on anything? I invite any others to contribute as well. Okay, well, if I hear silence, I'll move along. I'm comfortable with silence, but I will move along quickly. I want to be mindful of the fact that I know we have, I think, a full-on 8 minutes to address some questions. Next question. Oh, did I hear a voice?
Sorry, Ashani, I was going to answer one, bring up one more point, and I was on mute, so I apologize. But the point that Dawn made about data is really important, and outcomes. So I think if you're a non-for-profit listening to this presentation today, if you can think about what outcomes and positive outcomes and results that you can bring to the table, it's important. As healthcare charitable foundations, we still have a board that we have to report to, and they, have a goal of improving outcomes in the community. They want to see changes in food security. They want to see changes in health and equities. So making sure you bring that data and that information to the table is really going to be key and important about how you're going to report that information back to them and how you're going to continue to work with them on that. Coming forward to a foundation with a request that's just kind of, we want you to give us money and then we're going to go off and do our thing. It doesn't quite technically work unless you're getting money from Melinda Gates and her foundation. That's what she does, but not all of them do that. So a lot of them are driven by board outcomes, and they want to see those changes.
Thank you, Carolyn. It's excellent advice to think first and foremost thinking about outcomes and coming to the table thinking about that. So thank you for that. Let me go ahead and ask the next question. How can states engage with health plan foundations and partner to improve communities and meet the non-medical needs of Medicaid beneficiaries in their state? Now I'm going to pick on Eamon.
Right up my alley. Yeah,
yes.
my kind of question, Ashani. Thank you. I think this is actually a really, really exciting opportunity. I mean, and the thing that sort of I underline as I hear you ask that question is two things is the communities and non-medical needs. I think one of the, first of all, what we've seen is that there's huge alignment around the sort of shared value of health equity. And I think to this last question and to Dawn's response, really starting from that sort of shared set of values and mission and ethos is a really powerful place to begin a conversation. And I think to what Director Schneider talked about in her remarks is that the role of this kind of capital, this kind of foundation capital from the health plan foundations that can play in sort of catalyzing this work at the edges is a really, really important role for this work to play. And so as I think about non-medical needs, as I think about the social determinants of health, this is both, as we go around and talk to state Medicaid directors across the country, among the top 3 to 5 priorities for almost everyone that we've spoken with. So I think this is a really highly relevant theme. So, it's going to be aligned, with what states are trying to do. It's going to have a clear tie-in to health equity. And I think it's going to be able to unlock this, or capitalize on this really catalytic power that health plan foundation support can provide. So, what's really interesting to me is how do you actually use this as sort of pioneering capital to help states and others think about things that we might do differently, new kinds of innovations, whether those be sort of policy, technology, new kinds of partnership that can open up new ways of tackling these non-medical needs, new ways of serving the social determinants of health. So to me, this is really, I think, an extraordinarily exciting theme to focus on as we look at that sort of overlap and space for collaboration.
Thank you. That is a phenomenal answer. And I love how you started it off with the language of talking about shared values and shared ethos. I think that that's a consistent thread through all of the presentations, is this focus on health equity. So thank you for stressing that point. I want to invite Jamie to offer anything to contribute to that question.
Certainly. And I think I mentioned it, Ashani, in my earlier remarks, but Medicaid programs have limited flexibility in terms of how they can use Medicaid dollars to fund innovations like we're talking about related to whole person care and health equity. And that's where foundation work can be so incredibly powerful. I think I'm going to go back to something Carolyn said at the beginning of our discussion. She talked about the importance of inviting the member voice into the conversation. And I think that's really critical as we work to partner with foundations. Certainly we want strategic alignment. And I think we see a lot of that, as Eamon mentioned, when it comes to whole person care and health equity. But it's also, as we have that conversation, inviting the member into the conversation so they can start to really inform some of the solutions that we pursue in partnership. And that's one of the things I really love about the Medicaid Innovation Collaborative model is they've really infused that right at the beginning of the structure. Eamon laid out the framework, but really it bringing in that member voice as we seek to find those technological solutions that can advance those strategic priorities and focus ultimately on outcomes, right? And that's why I really wanted to talk a little bit about the work that we did with PICS Health and our plans are doing with PICS Health, because the end objective for us is ensuring that members are able to access enhanced care at a lower cost. And we're able to see that with some of the innovations we pursued through the Medicaid Innovation Collaborative funded by Molina Cares. And that's what's really exciting at the end of the day.
Thank you, Jamie. I love how you tied that right back to what Carolyn offered earlier around outcomes. So that was perfect. Okay, I think we have time. Oh, we got 2 minutes. I'm going to try and sneak in this one last question, and I am going to ask Carolyn if you'll kick us off after I read the question. A question that came in is, how would a state and an MCO foundation partner to meet a health equity issue? And I want to add the second part of that as well. But think about that first part for a moment. How would a state and MCO foundation partner to meet a health equity issue? And what are the possible funding levels for MCO foundations that are working on an issue with a state?
Yeah, I think sometimes state Medicaid agencies may not think of this, but sometimes it's just as simple as talking to the foundation after you start that conversation that Dawn was talking about around, this is what our needs are. Is there anything in this area of health equity that you're focusing on that we could fund or partner with together? Because these are the things I can't get done, and trying to see if there's a way that they can shape their programs to do that, if there's a way that they can shape what their boards want to get that done. And then in terms of funding level needs, it's easier to start, obviously, with smaller amounts, something that's $20,000, $25,000. Those are easier, obviously, grants to get out into the community and get them going faster, and build that partnership so that over time, maybe you can get the increased level of funding. And then also looking at what are the goals of the foundation in terms of what it's trying to achieve. Some of the healthcare charitable foundations really focus in certain areas like long-term care or health disparities or food insecurity. We happen to be one that focuses on what communities need across the country, so we vary our projects in that regard. But I think also knowing that amount and what they're focusing on that particular year will help you key in and hone in on that. In some states, for example, we really focus on access to care. So we're looking for partners that are nonprofits that are going to be able to go out there and really help members understand how to access care appropriately, how to make sure they get their services on time. So it's identifying what those needs are and then identifying maybe a way that you can kind of start small with it. But some foundations do larger grants. There's a lot more reporting associated with that, as Dawn was talking about, and there's a lot more in terms of outcomes and expectations when you get to those larger grants. But also being able to demonstrate some of the storytelling you're able to do as a nonprofit behind that is really key and important, because, one of the missions of the Molina Healthcare Charitable Foundation is to spread the work that we're doing nationally. So because we fund one project in California, we would like to spread that, frankly, across the country. Or something we're doing in Texas, we also want to see that work be effective in Michigan or New York. So the ability of the nonprofit to do some of that storytelling and be able to get that information out there effectively is another thing as a nonprofit you really got to stress and be able to demonstrate.
Thank you so much. That's a perfect response. I love you bringing up partnership and bringing in the nugget of talking about storytelling, which we didn't have a lot of opportunity to talk about today, but I so appreciate you bringing that up. It's critical. With that, I want to thank our panelists for today's conversation. I've certainly learned during the course of the webinar, which I so appreciate. All of you gave exceptionally good presentations and the conversation. Thank you, everybody, for offering up questions for us to address as well. You can see from the last slide that is here that future webinars will be scheduled soon. You can subscribe to the website to receive notifications. And with that, happy Monday. Have a wonderful afternoon. Thank you.